my name is Christy. I'm going to be one of your nurses today.
Okay.
Can I have you please verify your name and date of birth?
Yes. Michelle Gonzalez, July 5th, 1980.
Perfect. Before you're discharged, there's a couple things that we need to go over, one of which is the medication your physician has prescribed to you to help control your seizures.
Okay.
This medication will help prevent future seizures, so it's important for you to understand the medication that you'll be taking. The medication is commonly called Topamax, also known as Topramate. You will start by taking a small dose each week, and you'll need to increase the amount that you take. It takes a couple of weeks or so to get to the desired amount. It comes in a tablet form, and you'll start by taking one 25 milligram tablet in the morning and a second 25 milligram tablet in the evening for 1 full week. After the first week, you will then take two 25 milligram tablets in the morning and two 25 milligram tablets in the evening for another 7 days.
Okay.
You will continue to increase the dose every week by adding one 25 milligram tablet in the morning and another one in the evening until you have completed 4 weeks.
Okay.
At week 5, you're going to then increase by taking two 25 milligram tablets in the morning and two as well in the evening. And again, the same thing for week 6.
Okay.
We understand, so at the end of the 6 weeks, you should be taking a total of 200 milligrams in the morning and 200 milligrams that evening, so a total of 400 milligrams per day.
Okay.
We understand that taking 8 tablets twice a day is a lot. The doctor can then switch the prescription to a higher dose. That way you don't have to take so many tablets per day. It is important that you take the medication as prescribed because we don't want to shock your body with the medication.
Okay.
Here's a calendar that explains how many tablets you should take for the next 6 weeks. One of the other nurses will come in and explain more to you about the medication. Before I go, do you have any other questions about the medication?
I don't. Thank you, but that's a lot of pills. Hopefully the doctor can switch me over soon. But thank you.
Okay.
I'll follow the calendar.
Okay, you're welcome.
Hi Michelle, my name is Keisha. I'll be reviewing your medication with you a little bit more.
Okay.
So from my understanding, you'll be starting Topamax to help control your seizures. Is that correct?
From what the nurse told me, they prescribed me Topamax.
Okay. So great. Let's start with the basics. Topamax is either used all by itself, sometimes with other medications to control epilepsy and prevent future seizures.
Okay.
It also helps control migraines and has many other off-label uses. But for your situation, we'll just focus on your seizures.
Okay.
You want to make sure that this medication is stored in a tightly closed container at room temperature, so don't put it in your bathroom or any other place with moisture.
Okay.
Also make sure to keep it away from areas where children or any animals can access it.
Okay, that'll be easy to do.
Good, so there's a couple more important things we need to discuss about when you start taking the medication. First of all, this medication has known effects on a fetus, so you want to make sure you're on some kind of birth control on this medication. However, it's also known to decrease the effectiveness of the birth control in the pill form, so you'll need to add an additional form, such as condoms or an IUD.
Okay, so I'll make sure to use a different birth control method while I'm on the pill. But what if I want to get pregnant? What should I do then?
Well, if you feel you're ready to have children, just make an appointment and see your doctor, and they'll discuss your options further for that.
Okay, I'll schedule that when the time comes.
Great. A couple things you may notice while taking this medication is you may be sweating less, even though it's super hot outside. So just make sure you drink a lot of fluids and stay cool as best you can. This medication can also cause the acidity in your body to increase. So we'll monitor the levels of acid in your blood periodically, just by blood test every now and then, just to make sure you're in normal range. Now, one more nurse is going to come in and answer any other questions you may have. Is there anything else I can do for you?
No, thank you. But I'll ask the nurse my other questions. Thank you for your help.
All right. Nice to meet you.
Hi Michelle, nice to meet you. My name is Samantha and I will be answering any other questions you may have about your new medication.
Hi Samantha, nice to meet you too. Yeah, I have a few questions. What are the side effects of this drug, and is there anything I should look out for while I'm on it?
The common side effects of Topamax are changes in taste, nausea, and diarrhea, a stuffy or runny nose, and weight loss. However, if you experience any type of allergic reaction such as itching, hives, swelling of your face, hands, mouth, or throat, you need to contact your doctor right away. Also, this medication may make you feel depressed, nervous, or irritable.
Okay.
It can also change your vision or cause eye pain as well as confusion, dizziness, or weakness. If you feel any of these symptoms at all, be sure to call your doctor and be seen right away.
Okay, wow, that's a lot of side effects, but hopefully I'll be alright. What about crushing my medication? I know I have to take a lot of pills at the beginning, so is that an option for this?
No, do not crush the tablets. When you
Oh.
crush them, they may not work as well. I know it is a lot of tablets at first, but once you've reached the final dose amount, your doctor can change your prescription to a higher dose. That way you don't have to take as many pills at once.
Okay, I guess that's okay. What about, like, is there anything I shouldn't do while taking this medication?
Avoid drinking alcohol while taking this medication. Also avoid drinking or operating heavy machinery until you know how Topamax affects you. Everybody reacts differently to medication, so we want to make sure you handle the medication well prior to driving.
Okay.
Do you have any more questions that I can answer?
Yeah, so what if I miss a dose, or if I take too many, what will happen then?
If you miss a dose, take it as soon as you remember, as long as it's within 6 hours.
Okay.
If it is close to the time you are scheduled to take your next dose, don't take the missed one and just take your next one at the normal time you are supposed to. Now, if you take too many, call your doctor right away. You can start convulsing, become drowsy, have difficulty speaking, blurred vision, and much more if you take too much. I know mistakes happen, but try to take the correct amount at the scheduled time.
Okay, thank you so much. That was
You're
very
welcome.
helpful.
No problem. You're welcome. Is there anything else that I can answer for you?
Yeah, do you have like an information pamphlet so I can take home and read through it?
Yes, I do. This should be able to answer a lot of your questions.
Thank you. Yeah, this has all the information you just went over. Thank you
You're
so
welcome.
much.
Have a good day.